Hello, this is Dr. Versio. I'm the chair of pediatrics here at RUHS and so glad that you can join us for our webinar today. We're lucky to have with us again Dr. Tsang. We've had her as a guest, I think, a couple of times about a lot of different topics, and it's always a privilege to have time with her. I get to spend actually about an hour or two a week with Dr. Tsang, working on quality improvement in the ambulatory setting in relation to IT. And it's always a fun time. She has a wonderful sense of humor that occasionally Dr. Ron Johnson gets to highlight, and a wonderful laugh that he brings out. And so really excited to have her with us today to talk about quality improvement and performance in the clinic setting. I hope that all of us will learn a little bit about quality improvement itself and the methodologies around this. And she has a huge job, I have to say, at RUHS. Obviously, there's a lot of clinics that that the CHCs have sites at, and that represents a lot of patients that we touch. And then also, there's a lot of different quality metrics related to different programs that makes it a challenge to bring all those programs together. And so Dr. Tsang is kind of going to enlighten us on all of those things. So I'll turn it over to Dr. Tsang at this point.
So thank you for that wonderful introduction. And it's always a pleasure to work with Dr. Versio. We really have this great working relationship where we get to bounce lots of ideas off each other. And so thank you so much for having me again today. I'm going to try to play some music because I really, quality and performance improvement is all about teamwork, right? And, without a team, it's impossible to do this work. And in the title, I said, this is how we do it. So let me see if I can make the music play. Can you guys hear the music? This is how we do it. This is how we do it. All right. So, to get into the presentation itself, really, we're looking at how do we impact patient outcomes, right? I mean, that's the whole point why we do this work and why we're here. And sometimes people say, oh, quality improvement can be boring. It can be, tedious. It's just one more thing to do. But really, if we're taking care of patients how we would want to take care of our family members, we would be doing quality and performance improvement every single day on every single patient. So with that, I'm going to advance here. Let's see. I apologize. Give me 1 second. Let me see why my presentation is not working. Oh. Okay. Give me 1 second here. Let me stop sharing and reshare. I apologize for the technical difficulty.
So just want to interject here. If you have questions or comments throughout this presentation, please submit them. At the bottom of your screen in the middle, there's a Q&A section. And so you can submit questions through that, and I will read them out at the end of the presentation, or we can respond to them kind of in time, depending on what the question is.
Okay, so I think I fixed it. Let me get back on the presentation here, and I apologize. Okay, here we go. So, oh, oh, here we go. Okay. All right, so thank you for your patience. So quality, I think as we think about quality, what is quality and performance improvement? So if you think about the Agency for Healthcare Research and Quality, their definition is quality improvement is a framework we use to systematically improve the ways care is delivered to patients. And so how do we do that at RUHS? At RUHS, we really want to put the patient at the center. It's quality-oriented and data-informed care. So, as we look at how we do performance improvement, we have quality metrics that we have to meet. And we are, bound to 3 particular reporting agencies. And Uniform Data Systems is one through HRSA. As you know, we have our community health centers, and our community health centers have to report up to the federal government, which is through HRSA. And so every year, in fact, we just reported on February 15th, we report all of our quality data in addition to all of our outcomes data, productivity data, finance, all of that on February 15th. So we were excited to submit our data this year to UDS. We also report to the Quality Incentive Program through the state. This is our Medi-Cal waiver program, which brings in a lot of additional opportunities for us through financial incentives, and then pay for performance through our two health plans, IHP and Molina, in our clinics. And I'm just going to touch on each one. So through UDS, we have 18 measures that we have to report on, and they're your standard ones that look at patient outcomes, and we'll go over some of that. For P4P, so this is again, IHP and Molina are our two primary care, our two payers in our community health centers. And there's 26 performance measures there, plus, actually, because Molina just came on, there's more. And then through QIP, that is through the state waiver program. There's 51 performance measures that we report on through that. 40 are required, but 51 total measures that we track. So if you think about that, that's over 95 measures, right, that we have to track. And that's not easy to track all that data and try to do performance on all of those. So how do we do that? So there's a dream team that makes it all happen. It's, again, teamwork makes all of this possible. We have a wonderful quality and performance improvement team, as well as a healthy patient outreach program that does the outreach part. And together we form the quality and performance improvement team. This is one of the pictures of our amazing quality team. This was, right after the summer surge, before the winter surge, we did gather to think about how, we could strategize performance improvements, and then also partnerships, because quality is one component, right? And we need operations, we need finance, we need data with our IT teams. And so all of us together look at how we can improve the overall outcomes with our patients with the quality measures in mind, and how we track and how we move those measures forward. So it's really looking at not only the partnerships with all of our different entities, and in addition to the data portions itself. So, so that's the teamwork. And then how do we work at this? And so, as Dr. Versio alluded to, we have meetings, and the meetings aren't just to meet. The meetings are really to move performance in a variety of different ways. So we have work group meetings with our EPIC IT side. And that's every Tuesday. We get to hang out for an hour to 2 hours, like Dr. Versio said. We have EPIC builders, architects, analysts that help us, make sure that we're capturing the data as completely as possible. We're dropping all the codes that need to be dropped so that we can optimize, all the work that's being done by our care teams and our providers, and get credit for all that work. And also do new builds. And so sometimes when we have new measures, we find that we need to be able to track that efficiently within EPIC. And discrete tracking is really important in order to be able to account for the work that we've done. Wednesdays are traditionally set aside for quality work groups. So, we have a ton of work groups, and I'll go over that in a second. And cross collaborations, like we said, really looking across not only internally, but we also have cross collaborations with SACS and Loma Linda, because we are on an enterprise EPIC system. And so being able to leverage what has been done already, maybe at another site, or sharing the work we're doing, makes us all better in terms of how we do our patient outcomes. So I'm going to also talk quickly about, we also have report out meetings. So, we not only have a large quality meeting monthly, we also have a performance improvement committee that meets biannually, where we share our best practices with our quality team and clinic leadership. We do performance improvement rounding quarterly, where we go to clinics and do clinic specific PI plans and PI worksheets. And that gives us an opportunity to Gemba at those clinics as well. We also have quality team members visiting the clinics throughout the month to help drive performance improvement initiatives, where we also, work on A3s, we do audits, we do data assistance, it's kind of all that through individual visits at clinics, and then clinic staff meeting updates. So those are some of the meetings that happen, and then we have work groups. So this is where the meat of the work really happens, where we drive change. And so these work groups are categorized and de-siloed to really make what I call the magic happen, right? And there's leaders for each of these work groups that help to drive the work while, between all these different meetings, all this stuff is going on in the background. So here I highlighted, I think there's 10 work groups that I highlighted here because I'm speaking specifically to ambulatory quality right now. And so these are our ambulatory quality work groups. And you can see we try to, again, de-silo because we have 95 measures, to 3 different main agencies. It's impossible to have all these different work groups. So we just combined everything in one. So we have a pediatric work group. And in the pediatric work group, for example, you can see there's a coordinator, a nurse coordinator, a clinical lead, members of the team who participate from ops, from quality, from data, from finance. We try to include everyone to be represented. And then you can see how all the different programs are represented as well here. But what we try to do is lump the measures that cut across all the different reporting agencies. So we do that for every single one. I'm not going to review every one, but I just wanted to give you a quick review of what that looks like. And so these work groups usually meet monthly, sometimes more often. So this is our diabetes work group. There's a ton of measures, as you see here. At least once a month, if not twice a month, if there's something, that we're really working on and trying to get done, we will meet more often. That's the cardiac work group. This is the transitions of care work group. So all the post-discharge follow-ups, behavioral health, all our depression screenings, our substance use assessments. And we work very closely with our behavioral health teams. This is our preventions and just screenings in general. So chlamydia, tobacco, colorectal, all the cancer screenings, HIV, now with the new ones, social determinants of health, things like that. We add all these in so that we can work on those as a work group and try to prioritize and figure out what our focuses are. And then here's our women's health group with Dr. Oshiro helping us with leading that, medication management with our clinical pharmacists. You can see asthma medication ratio falls under there, which Dr. Versio did a ton of work on. And then here is our immunizations work group, looking at immunizations across, these work groups meet and again, really focus in on where we can move the target, what is clinically relevant, and how we could increase the overall outcomes and performance for our organization, but also how we do that work to really impact patients, right? So it takes a village, as you can see, and there's a lot of measures. Okay, and the last one is, all this work needs to have kind of a basic foundation of how we systematically do that work. And we leverage Lean to do that work. So as an organization that's pursuing Lean across, we've all undergone Lean workshops and training. All of our projects have an A3 attached for the most part so that we can track the measures and outcomes. And this helps drive our work. So we do use a foundation of Lean. We're excited that, you probably have heard some of the rapid improvement events happening at the clinics, being led by Dr. Khan right now on the operations side. And so, we're excited to have all of us using Lean to better overall processes. So, there's work around the work groups, but then there's also tracking of the data and sharing data. And that is a whole nother animal on its own. So, I'm going to show you some examples of what that looks like. So for tracking, and this is, I stole this from Kirsten Odell, one of our nurse coordinators that does a fantastic job at tracking. You're not supposed to read the small print, by the way, just to give you a flavor of what our dashboards look like. But it's a lot of data that we track, right? And then we're tracking not just for one reporting entity, we're tracking across 3, and different populations that are measured within that. But us as a quality team, we actually look at everyone as a whole. Like we don't think about, oh, this person belongs to HP, this person belongs to Molina. this person is UDS, we actually look at our entire population and track them in that way. And then when we have to report, we drill down to the populations that are required for reporting. So we also use performance improvement worksheets. So when we go out to our clinics, we provide these worksheets that are individualized to the clinic and how that clinic is performing. And you can see we do a trending. So you can see how you're doing first quarter, second quarter, third quarter, fourth quarter, and then how you're doing, how you did for the year, and then how you're doing year to date. And then we set goals. So we have our RUHS goals, as well as, you know, if they've exceeded the RUHS goal, they have an opportunity to set a new goal that's higher than the goal that we've set as an organization to really help kind of drive and push improvement at the clinics. So this is something that's provided to every clinic quarterly as we do our performance improvement rounding. And then, you know, reporting of outcomes, again, you know, we try to graph it, make it easy to read so that, and we do a comparison across the clinics. And so, you know, it spurs a little bit of friendly competition. This is put together by Carolyn Nettie and our teams to help show this data. And then we use this to also put up on the huddle boards. And so that the staff and the providers are aware of how they're performing as a clinic, and then just gives the clinic an idea of how we're doing overall compared to others in the system as well. Okay, so I think this is the last part is the best part. How does all that work then result into patient outcomes, right? So we always continue to strive for the best outcomes of our patients. And, you know, I think we were very lucky in 2021 to achieve some awards around that. So HRSA did award us. So this is the federal government for our community health centers, did award us a Health Center Quality Leader Award. We achieved bronze status, which means that we're in the top 30% in the country around the quality and performance improvement outcomes for our patients. And we were really proud to receive this award. And we hope to continue to move up. There's 3 categories, as you know, because the Olympics are happening right now, right? We have gold, we have silver, we have bronze. So we really want to start moving into the silver category and strive for the gold category. So that really it helps to highlight, you know, the great work we're doing here at RUHS. This is not our first year receiving our advancing health information technology for quality. You know, this is probably our 3rd year receiving that. And again, we continue to leverage our EMR to really drive patient outcomes. And so we were very lucky to have both these badges of honor this year from the federal government. Also, what does that mean for patient outcomes, right? So I wanted to share with you, there's a ton, as you know, we have 90-something measures. I'm not going to show you all of them, but I did want to highlight some that are clinically important to us, right? So, you know, diabetes control continues to be something that we know if we can control patients' blood sugars, it will impact them in the long term for the rest of their life. So we have a large number of patients with diabetes in our ambulatory care, primary care setting. We have 12,519 patients with diabetes. This number, the 33.51, shows you how many are currently uncontrolled. So the lower, the better. During a pandemic year, we actually saw most organizations were either held steady or showed some movement in the wrong direction, where patients essentially became more uncontrolled. You know, we were really lucky this year. We actually had a 10% improvement for our patients with diabetes. So, you know, we had 478 more patients get to goal, and we were able to maintain, you know, the rest of the patients so that we were able to then have a net improvement in our overall diabetes control. So I'm very excited to share that. Even though it doesn't seem like a big number, it is huge during the pandemic years. Blood pressure control, same idea, you know, really maintaining and doing performance improvement while we were having access disruptions and, you know, during a pandemic, during the pandemic waves, this was really hard to do. And as we moved to telehealth visits, we're really proud to see that we still were able to make improvements, although modest, was still a positive movement with 669 more patients at goal this year, while still maintaining the overall numbers of those that are at goal for our blood pressure control for patients with hypertension. We have a large volume of patients with hypertension. Over 20,000 patients that we have hypertension. So that's about 1 in 5 of our patients. So that's a large number, and very proud to see that number. Okay, now prevention. So I'm going to highlight cancer screenings. So for colon cancer screening, we had huge improvements this year. We had a 25% improvement over 2020, and this is 2021 data. We just closed out 2021. So we screened 2,649 more patients in 2021, and we are above national average, which is why it's in green. We still have a lot of room to go though. So as you can see, we still have a little bit over half our patients that still need to be screened for colon cancer screening. So even though we're proud of our achievements, we still need to push forward on this one. And same with cervical cancer screening. We had a 23% improvement, 2,760 more patients were screened in 2021. And for breast cancer screening, we had a 9% improvement, 576 more patients were screened in 2021. What we're doing here, because these numbers are huge, if you look at these numbers, right, we're in the 20,000 range, almost 30,000 patients that we have to reach out to. So we leverage technology to help us with that. So we leverage Cypher Health, which helps us with robocall and texting to inform patients that they're due or overdue for their screenings. And then what they do is they will have an opportunity to ask for us to help schedule their appointment. That way they don't have to call. We will call and do an outreach with them through our Healthy Patient Outreach Program. And then we can, through protocol, schedule some of these visits for them. So mammograms, working with Dr. Keith Garcia in radiology. Through protocols, we can schedule those patients. Cervical cancer screening, working with our clinics to increase access for that. And then colorectal cancer screening, our outreach team can mail out fit kits and also, schedule them in clinic to get those patients seen. So, just very excited to share some of our successes with you around some of the quality measures. And so with that, this picture here is a word map of something the staff put together a few years ago when we did a retreat. And, you can see care and compassion and quality, all are things that we as an organization really, I think, take to heart and really want to make sure that we imbued all that in all that we do for our patients. And so the last thing I want to mention is we were in December of 2021, we were given the honor of honorable mention from the state for our work around controlling high blood pressure in the midst of a pandemic. And this is, I think we were very honored to receive this award. And I think we were the only system that showed kind of an improvement and submitted that to the Quality Leaders Award through CAPH. And so, just wanted to share that as well as a little feather in our cap for quality. So with that, that's just a brief overview of how we do it in our quality and performance improvement world. Again, it takes a village. We have wonderful teams and leaders within our performance improvement teams, and I'm very happy to share that work with you today. Thank you.
Thank you so much, Dr. Tsang. It's just amazing. As you were putting, holy smokes, that's a lot of data. I was thinking, holy smokes, that's a lot of metrics, a lot of programs, a lot of work and work groups. So thank you for leading, being one of the leaders involved with that. I do have a question, and of course, I want to make sure that people know that they can send in questions to the chat. We definitely want to make this as interactive as possible. And so getting your questions is really engaging for us. My question relates to, how did lean methodology, we started on that journey 5 years ago, I believe, or so. And how did that kind of impact the approach your teams take, the way you structure teams and things like that?
Yeah, that's a great question. So, lean helps us really think about not just jumping to the answer, right? And not blaming people. And, really makes us take a step back and listen to what's happening in the clinics, observe with Gembas what's happening in the clinic, and really focus on processes. And so I think, using lean as our foundation really helps us as a team understand the needs that are maybe causing some barriers for improvements in care, which again is a process issue, right? And so really looking at the overall processes and what is an impactful process and what might not be a necessary process, and eliminating the waste around the many steps that might need to be taken. So an example would be, for example, our Healthy Patient Outreach Program team. Our HPOP team, once we formed that, we had standard protocols in place where we could order a mammogram for a patient who's overdue. But before, that patient had to go to clinic, get an appointment, had to first of all call, get an appointment, go to clinic, and the provider had to, either the care team pended it for the provider or the provider had to order it. Then the patient had to call radiology, schedule the appointment, and then go to radiology. We cut out all the steps in between. And now the HPOP team, using standard protocol, and with the input from our providers and from our radiology teams and operations and everybody, can now schedule that patient directly with radiology. So we've cut out all those steps, right? And so now that patient gets on the phone with one person. It looks like you're overdue. Can I schedule you? What time would you like? Great. And the patient goes straight to radiology. And those results then flow into our providers and baskets. So, I think that's a wonderful example of, really kind of listening, doing Gemba walks, understanding the hoops our patients have to jump through, and then trying to work together as a team to figure out what process is the most efficient and the most user-friendly for our patients.
Awesome. So what things are you looking forward for 2022 as areas for improvement? And then also kind of what steps do you feel like need to be made in the lean journey?
Yeah, so I think we can always continue to grow in lean. I'm always learning. I think that's the beauty of our job. We get to continue to learn. So I think there's a lot more we can learn about lean and how lean can help us. Not just the how to do it, but the how do we implement lean as a culture, right? And so we're seeing some of that with Dr. Khan's work in the clinics. Angela Simpkins has been also looking at how we can improve the overall process of lean in our organization. So in 2022, which is this year, we're already in February. We're looking to continue to leverage technology to help us with outreach, because you can see the large volume of lives we're dealing with. And, individual one-to-one outreach at the clinics is absolutely important. And we have standard workflows that are in place and continue to be refined to do that work. But also, how do we do large population health outreach effectively? And how do we increase access to make sure that patients who want an appointment and need those care gaps closed have ready appointments for them that is convenient for them, so that we can bring them in to get the care they need.
Awesome. Well, thank you so much for walking us through what a little bit of your life is like, and sharing that with us. Really excited to see, what happens for 2022. I'm sure it will be great things. Hopefully we'll get into the silver or gold round of awards. And thank you to everybody for joining us this afternoon. All right. I hope you all have a wonderful week.